Hi there guys, shooting up a follow-up video to my rotator cuff surgery. It's been 2 weeks post-operation and I was in to see the surgeon yesterday and he informed me that they had to do a repair of the full thickness tear to my supraspinatus tendon. They also had to repair my infraspinatus tendon, and there was also the relocation of the proximal end of the long head of my biceps tendon. Typically, he said surgery for rotator cuff is usually around 45 minutes. Mine took around 2 hours, so that just goes to state to the severity of my injury. In regards to pain meds, I took them for around 2 days after the nerve block came out, and two and a half days, and then I just stopped taking them. And since then, pain's been manageable. It's still around a 2. The only issue with pain is that it's hard to sleep. I haven't really slept in 2 weeks because every time you get into a position, even though the pain's not that bad, it's enough to keep you up at night. So there's that. But I mean, otherwise, besides that, I actually feel really good. I'm surprised I'm functioning as well as I am on very little sleep. As you can see, I'm no longer wearing my sling, which I informed the surgeon yesterday that I haven't been wearing for about 3 to 4 days. And normal protocol for just a rotator cuff surgery is about 6 weeks to be in the sling. He agreed that I could be out of it as long as I was careful, and it feels way better. The sling was forcing my shoulder into protraction, which was lengthening the posterior muscles of my shoulder, making them weak, and it just didn't feel good. And so I started slowly exposing my shoulder to being out of the sling, and like I said, it's probably been about 3 or 4 days. I haven't had it in at all. So I don't wear it when I sleep. I use pillows to stabilize my arm, but no sling. So that's going really good. Range of motion has increased. Passively, I can get about 30 degrees of flexion of my shoulder, which is raising the arm in front of you, as well as about 30 degrees of abduction, raising the arm laterally or to the side of you. I haven't messed around with internal or external rotation yet because when I talked to the surgeon, he doesn't want me doing any physiotherapy or any rehab for at least another 4 weeks. So we talked, and I said I'd probably mess around with some passive range of motion like I've been doing, but that's it. And he agreed that was a decent idea, so that's what I'll be doing. Activity-wise, I've been going to the river valley, walking stairs for cardio. You can't run, obviously, because of the balancing. The shoulder can't be exposed to that. So yeah, doing stairs in the river valley, which has been nice because it's spring. And last weekend, I was able to get a decent lower body workout in. And then a couple days ago, I actually did horizontal and vertical push-pull just on my left side. That felt fantastic. That felt really good. I obviously won't be doing any of that with my right side for a while, but I find the more I move my body, the better I feel. So I'll probably keep messing around with that kind of stuff. Daily activities, I can pretty much do anything. Like showering, getting dressed, all that kind of stuff is really, really good. It's no problem. I can clean. I've been cooking for the wife. She's pretty happy. Doing yard work. I cut the grass with my lawnmower and did some weed whacking. Obviously just using my left hand, but there hasn't been any issues with that. And like I said, the more I move around, the better I feel. And for me, I'm not suggesting you do anything that I've done. I'm just saying that for me, the more I move around, whether it's walking or doing daily activities, the better my shoulder feels. It feels way better, and I seem to be healing quite fast. So with that said, I have a follow-up appointment in another 4 weeks. If I experience some really good progress before that time, I will shoot another video. If not, I will wait until I speak with my surgeon again, and then I'll shoot another video and update you guys. Thanks a lot, guys.